This is Late Night Health, the radio show and video program that cares about the most important part of your life. During the next few minutes, Dr. Greg Celaya and I are going to talk about a health topic that affects each and every one of us. Hi, I'm Mark Alyn. Thanks for joining us. We're going to switch over to Dr. Greg Celaya, and we're going to talk about something called berberine. What is berberine?
Hey, Mark, it's good to see you today. You know, it has a lot to do with blood sugar. Did you know that 90% of pre-diabetics don't even know that they're pre-diabetic?
I did know that. And it can be very serious, I understand.
Yeah, so berberine is an herb, and it's found in plants such as barberry, golden seal, Oregon grape, tree turmeric, and even Chinese golden thread or gold thread. And the Chinese have used this herb to treat digestive and infection issues for thousands of years. In fact, even now, it's like a deep yellow pigment, and we use it as a dye. And its purpose is to help move glucose from your blood into your cells. Berberine activates an enzyme called AMPK, which regulates how the body produces and uses energy. And metabolic syndrome happens when AMPK regulated pathways are turned off. And what that does is it triggers fat storage and burning abnormalities and high blood sugar and diabetes and even energy imbalances. You know, the berberine, I use it on a lot of patients, and I use it as a great antioxidant in addition to blood sugar regulation. And there's so many benefits. It can help with cholesterol. Like I mentioned, it's a good antioxidant, anti-inflammatory. It can even help with weight loss, and it's antibacterial. And tobacco smoke-induced lung inflammation can be helped with berberine. Here's a good one. It even can inhibit cancer cell growth and proliferation. And they found that it's even neuroprotective, means it protects neurological tissue, the brain. It can help stimulate bile and also help with intestinal health.
I don't care about anything else. Give it to me. I want it now.
There you go.
Right? Is it something that's easy to find in health food stores?
It's usually, you want to make sure you get a good quality. And, you know, with dosages, usually we're about 500 milligrams 2 to 3 times per day. But you have to be careful because your gut bacteria has to be really healthy as well, because it helps us digest it and be able to utilize it. And you don't want to be on it on a full-time basis because it can be harmful. We want to see it in a pulsed fashion, meaning 8-week cycle, maybe with 2 to 4 weeks off.
Got it. What about things like cinnamon, and there are other herbs that are used to regulate blood sugar?
Yeah, there are so many different things, and berberine is a really good one. In fact, there's been research that shows that it's even as effective as metformin, which is a diabetes medication. And so you just have to make sure to really monitor. But you know, there's also contraindications. You have to make sure that if you're on it long term, it can cause liver issues. You don't want to be on it when you're pregnant or nursing. It can interact with different medications. And if you're on something to reduce blood sugar and you take this, you may end up with really low blood sugar. And it can even decrease blood pressure. So here again, it's a great herb, but it's nothing to be just abused and taken just to take, right? Like I'm always saying.
And you called it berberine. That's an interesting concept. Just using the herb itself is called berberine.
The herb is called berberine. Yeah.
Berberine, not berberine.
Berberine.
Berberine. Spell it.
Berberine. Berberine.
Berberine. Gotcha. And you mentioned metformin. There are some problems with metformin being taken over long periods of time. Obviously, some people need it immediately, but others, it's not one of those better drugs, at least in my opinion, as a non-medical, non-health professional, from what I've read.
Well, the problem with all these, including this is a great herb substitute for a lot of those types of medications. But the problem is that you've got to fix the root cause of the problem, right? You can't just take this stuff and still live your lifestyle like you have been, because you're going to end up with other problems. So it's get to the root cause, Quit treating the symptoms. And this is a symptomatic type of treatment as well. But it's a great option on a temporary basis while you fix other things.
And what would those other things be to fix? In other words, your diet, more exercise, things of that nature?
Yeah, there you go. You should be the guy on the other side of the mic here. That's exactly it, right? Diet's huge. Exercise is huge. And you have to make sure to do the right testing to make sure we understand what's happening. But once you get to the root cause, you can understand it. But diet is most likely number one on most people.
And followed, of course, closely by exercise, because that also helps.
Right. I mean, if you're diabetic, you've had a lot of things going wrong for a long period of time enough to change DNA, right? There may be a genetic predisposition, but it really doesn't have to happen. Even if you have it in your family, you just have to be extra diligent to fix what's going on before it even starts.
I know that people with diabetes, it doesn't happen overnight, right? And if you do have the genetic predisposition, can you change that? The new science of epigenetics, for example, comes to mind.
Yeah, you can. I mean, there's type 1, which is a genetic issue, which is an autoimmune problem, which is really difficult to deal with. Type 2 is the type that's more predominant out there. So yes, absolutely, you can change type 2. It's just a matter of really getting in and changing lifestyle. And it may not be easy for those people because there's a lot that's gone wrong for a long period of time. But it can be reversed, absolutely.
And type 2 is the kind that usually they call it adult onset. And it's a lifestyle issue from my standpoint.
Absolutely, it's a lifestyle issue. And it's just a matter of changing things. I mean, like I said, it's not easy for a lot of people because they've lived this way for a long period of time. This didn't show up overnight, and it's not going to go away overnight.
And of course, this is almost at epidemic proportions throughout the United States.
Yeah, it's huge. I see people that it's just a matter of fact to them. Oh, yeah, I have diabetes. No big deal. What else can we work on? And it's like, you can't work on anything until you fix blood sugar. I guess, or sneezing.
Yes. Sorry about that.
You can't work on anything until you fix blood sugar.
That's it is key.
Because it's not only the sugar, but it's inflammatory. So it is key to working with everything else in your body.
It's really related to gut health, is it not?
Well, there can be gut health, sure. I mean, gut health is part of it. There's so many things to it. But if your diet's lousy and you're either consuming anything that is sugar, anything that turns to sugar, like I mentioned to you before, even protein, you're going to have a problem. You're going to create inflammatory issues, and diabetes may be up your alley when you end up with metabolic syndrome.
And from metabolic syndrome, if you don't take care of it, it can advance into type 2 diabetes.
Yeah, absolutely. And then you've got any disease can be opened up to you once you have diabetes, right?
Right.
So it's a matter of getting down to the root cause, and take it serious. Don't just sit around thinking, oh, it's no big deal, I'll just take the medication. It's not going to fix your problem.
Well, Dr. Celaya, any more comments about berberine before we end this session?
No, it's a great herb. You have to make sure it's good and clean, it's produced well, and you use it the way it's supposed to be used. You don't abuse it, and you don't just take it to take it.
Gotcha. Dr. Celaya, thank you very much. If you want information on Dr. Celaya, visit him at drcelaya.com, drcelaya.com. Look around. There's some videos, there's audios, there's a lot of posts and blogs, and you can sign up for a free 15-minute consultation with Dr. Greg. I'm Mark Alyn at Late Night Health, and you can visit us at latenighthealth.com. For Dr. Celaya, we'll see you next time. Bye-bye for now.